Good morning, everyone. This is the Regional Advisory Council meeting, Thursday, June 25th at 10 a.m. I am Laura Chronic, the chair, and I am calling this meeting to order at precisely 10 o'clock. Do we have a quorum? Yes, we do. Thank you. So we will now do introductions. I just introduced myself, Mr. Rick. Let's go around the table. Oh, before I do, I want to acknowledge Joe Urban, who is our interim
Interim PPACG or PPAAA director.
director. Thank you. Thank you very much.
Glad to be here. I'm just trying to fill a few gaps for Jody while he's gone. For those of you that I don't know, which I actually know most of you now, I was the director here for about 4.5 years, 6.5 years ago. So a lot of the things have stayed the same, and obviously there have been some changes, but I'm happy to be back and help out for a period of time while he's gone.
Welcome,
Thanks.
Mr. Rick.
Gordon Rick, representing the city of Fountain.
Jared Berner, Public Policy and Communications Manager at PPACG.
Mariah Cabrera, Contract Administrator for PPAAA.
Debbie Levin-Stankiewicz, volunteer on the area agency, Regional Advisory Committee, and on Colorado Springs.
Bee Babbitt, representing Northern El Paso County.
Melissa Martz, Program Development Administrator with the Area Agency on Aging.
Scotty.
Hi, this is Scotty Bibb from the Independence Center.
Sheila.
Sheila Williams, representing Park County.
We're bringing Jen up.
Oh, okay, yeah. Jen?
Hello, Jen Nemo with Colorado Community Health Alliance.
Thank you. That's it. Perfect. Okay, do I have a motion to approve the agenda?
I'll make a motion to approve the agenda.
Second? Is there a second?
Second that, Bee Babbitt.
Thanks, B. All in favor? Aye. Any opposed? Hearing none. The agenda is approved. The consent agenda. Do I have a motion to approve the consent agenda?
Gordon Rick, move to approve the consent agenda.
Debbie Levin-Stankiewicz, I'm second.
Thank you. All in favor?
Aye.
Any opposed? Hearing none. We'll move on to public comments. Are there any that have been submitted? Tom? None submitted? Anyone in the audience that would like to render a public comment? Hearing none, we will move on. This is going to be a fun day. We have no action items. We have information items, presentations. What presentations are we? We have none. Jurisdiction update to member governments. Yes, Melissa.
So this is a reminder for those folks who have been appointed by our jurisdictions that we have a goal of presenting updates and information from our Regional Advisory Council, along with our Commission on Aging members, to our jurisdictions in the month of October. And so we will be having our first preliminary meetings on this in July. So I'll be, doing some scheduling, arranging with our appointees for a July meeting.
Super. Thank you very much. Are you also reporting on the membership committee, or is Jen doing that?
Nope, Jen is the strategic review subcommittee and membership subcommittee. Thank you to Scotty, and thank you also to Lakita, who was on our SRS meeting yesterday, but not with us today. We are still working on doing an orientation with these two women. So from the Independence Center and Department of Human Services.
Thank you. Now it's Jen. Strategic review.
Hello. We met yesterday, and the update is that we have, I think, all but 2 community conversations scheduled. There will be a variety of different locations. So Melissa will be, I'm going to rely on Melissa to share that schedule and the different locations. We decided that the invitation will include the different places and dates that they will happen so that lots of people can join those conversations. The timeline that we're looking at is having our SRS meetings on the second Fridays of the upcoming months. We're in the starting phase of the 4-year strategic plan writing. So the second Fridays at 10 o'clock. So coming up in July on the 10th, the second Friday of August and September. Then by October, we'll be going bi-weekly meetings. So that will be in October and November. By October, we'll have a working draft that will go, a rough draft that will go out, and then by December, you guys will see a rough draft of the 4-year strategic plan. And then 30 days open for comments, and then it looks like a final draft goes to the state in March. There's a possible rough draft or a final draft that goes out to the RAC in February, but we're still kind of working on all those details. So we got a lot accomplished yesterday. Melissa, anything that I've missed?
Thank you, Jen. And thank you to those people who are doing the strategic review subcommittee. Clark Becker has volunteered to be the facilitator for, I think, all of the meetings. And except for possibly one, I think he's traveling right now. So that's why he's not with us today. And so just great that he's going to be the facilitator. And Gordon has volunteered to be the recorder unless other people are wanting to step in and be the recorder, which means we'll have flip chart paper, up, and Gordon or whoever else wants to do recording will be kind of gathering up the thoughts and comments from the folks. We're working on off of basically about 11 questions and a 2-hour time frame. And our first one is coming up in Teller County on July 9th, which everyone has gotten that invitation and has, for the most part, people have either declined that they can't make it or have RSVP'd that they could come. And Kathy Lowry at Teller Senior Coalition has been working to secure another elected official to be in the room there. Of course, we will have Clark, who's the past mayor, and we'll also have Bob Foster participating from the Commission on Aging, but Kathy is reaching out to some other individuals. And I do see Kathy on there. I don't know if, Tom, we can allow her to speak if she just has any comments or questions related to the event coming up on the 9th of July. We'll give that a second.
Hey, Melissa, it's Kathy.
Hi, Kathy.
So I think we have the mayor of Cripple Creek and the mayor of Woodland Park coming for part of it, not all of it. They've got busy schedules. Do you have a lot of people signed up, or should I send the flyer out again?
You could definitely send the well, I have to say I have gotten emails from 5 people RSVPing. I don't know how many people have actually taken advantage of our online kind of ability to kind of RSVP. Jared is just now back from his holiday away, so I'm not going to really put him on the spot unless he actually already looked.
I don't know.
Okay.
I can check after this meeting, but I don't know.
Thank you. So yeah, I think go ahead and feel free, Kathy, to keep sharing it out for sure. And we'll keep looking for those folks to come. The goal is to have 20 people at each of our community conversations. And we want many of them to be older adults themselves who are living in the region. But we also, of course, want our, agency people to be there as well. For people who took part in this 4 years ago, you'll remember that we encouraged agency people to take their agency hats off and really try to think of what it means to be an older adult living in the area and commenting from that perspective and not just necessarily from your agency perspective. And then, as I mentioned that, for the agencies who are on the call today, you will be queried on your highest needs. So that is going to come to you guys. So you will have a chance to put in your feedback from your actual agency perspective. So stay tuned for that. I think that's all I have, and I'll turn it back over to our chair.
Thank you.
Madam Chair, I have a question. I'm just
Oh,
wondering if,
Skip. Before we, what time is the event divide?
Okay, from 10 to 12. So all of our events right now are from 10 to 12. It's very possible we could have a different time for the Colorado Springs and Falcon ones. But right now, all of them are 10 to noon. And we are working on the flyer with times to come. So,
Okay, thank you. Debbie?
I'm just wondering if Melissa can let us know when there might be information coming about carpool.
soon. Thank you for, yeah, we'll definitely be riding together July 9th. I will be thinking that through. Thank you.
No, I know because Clark probably is.
Yep,
giving me
yep,
rides.
yep, yep.
Yeah, I'll
We all do.
do it as well.
Great, super.
That's a definite maybe.
Yeah.
Yeah.
All right. Thanks, you guys. Thank you, Jen. After I said all that, I don't know if you have other things to add.
No, I'm good. Thank you very much.
Well, I'd like to thank you for the flyer, as we discussed yesterday, and this is wonderful, and hopefully we can get this out to the masses. Because I'd sure like to see, lots and lots of people. Yes, Melissa.
So one more thing, Jared did get it in the publications up in, so the Ute Country News and the Flume. Because I did get an email from them saying they got information, so.
And the Pikes Peak Courier.
And the Pikes Peak Courier. So we do have it running in those publications up in those.
Okay, and I forwarded the information to both of you by OCN, because that's another 21,000 people. Not too shabby. Okay. Sir, Rick, Gordon. George.
So on your flyer, I don't see the date on here for Fountain.
I was waiting for Jared to come back.
Okay.
And we'll get it. But thank you for noting it and realizing that. So, yep, thank you.
Thank you. See, everything pivots on Jared. I like this. Okay. Let's move on to the TRS, the Technical Review Subcommittee.
And I don't have anything new, but maybe Mariah can talk about where we are because new contracts are supposed to be coming out in July. I mean, the committee doesn't have anything at this point.
Thank you. Yes, I do have updates. I would say probably a third of the contracts are already signed, and I'm waiting on a few other pieces. I'm hoping that if not by this Friday, that Monday, all of the contracts will be signed. And in time for July the 1st.
Wonderful, thank you. Okay, I guess Melissa, are you standing in for Joe? Okay, for the director's report, please.
Thank you. So Joe and Jody both are actually on the State Unit on Aging meeting that's happening right now. So that's good. At that State Unit on Aging meeting, they're actually talking about 4-year plan information that then Joe's going to share back with me. So that'll be helpful. I think you all received the kind of opportunity to contribute to support Jody as he's continuing through his health issues. We did receive some information on him, but we are still waiting for him to confer that we can share that out to everyone. And so just stay tuned. we were hoping to have that information today, but we haven't gotten it yet. So hopefully that'll be something that we'll be sharing shortly. And so please, keep them in your thoughts. And if you want to participate in that, with that donation opportunity, you can either talk to me afterwards or I can forward you the information again. There's a Venmo. And if you don't do that, people are doing other things. So just talk to me if you have questions about it. And so from an area agency on aging perspective, we do have 2 other staff in the room with us today. We have Katie, who's in our SHIP program. We have Chris, who's one of our case managers, focusing a lot on housing issues. So it's nice to have those guys in the room with us today. And just a lot of things happening. We are in the process of updating the yellow books, looking at SHIP outreach. And that's all. I'm going to stop right there because and if I have other things, I'll share it at the end with announcements. Thank you.
Great, thank you. Moving right along to Mr. Jared.
Good morning, everyone. Jared Berner, once again, Public Policy and Communications here at PPACG. Thank you for everyone for being patient with me. It's been about 3,500 miles, but no car issues, so I was okay with that. But they decided to still do legislative stuff while I was out, so I was catching up this morning. On the federal side, the appropriations process is moving along pretty nicely. All 12 of the appropriations bills have made it out of the appropriations committee, which is a good sign. 2 of those 12 have made it through the House. None of those 2 bills are the labor and HHS bill, which is what we all care about in this room. But that did go through. With small increases for various Older Americans Act programs. Not huge, $1 to $2 million increases in different programs throughout different, and that's nationwide. So by the time you split that across 50 states and all the territories, and then you go even further down to our level, it's not much, but we'll take anything we can get. It's definitely a lot better than the alternative, which is a decrease. So we were very happy to see that on the appropriation side. So far, that is going very nicely. Also on the federal side, we're following a rulemaking process, not one that we're too concerned about, but it is something I wanted to bring to this the RAC for awareness. The Office of Management and Budget has a rulemaking process going out right now. It will likely impact a lot of agencies, but I don't think in anything that I would consider to be significant. What they're doing essentially is streamlining the federal grant making process, because right now each agency does its own thing. And so this is essentially trying to consolidate into one process for the entire federal government. For someone like me, for example, it's all about me at the end of the day. I mean, no, I'm kidding. But we receive federal grants from 4 different agencies. HHS is the one that funds the AAA side, but our military programs are funded through the Department of War programs, and some of the wildlife programs are funded through the Department of Agriculture, and then obviously our transportation is funded through the Department of Transportation. So 4 different programs, 4 different procurement processes, 4 different, just goes on and on. And then even some of our providers, they receive money from other agencies than the AAA as well. And so they are having to manage all those different programs as well, and different processes and different forms and different platforms, which usually means different passwords that you can never remember, except when you need to reapply every couple of years for those funds. And so while there could be some changes just in terms of operation and that kind of stuff, at the end of the day, we're really kind of looking forward to this being able to, once the changes are made, everything being in one platform. That rulemaking is still active. We're not planning to chime in on it just because there's some other things in there. But I think it looks promising. I think this would be a good move as presented of OMB in terms of the federal grant making award and just management and reconciliation process. So that's the federal things we're looking at. On the state side, relatively quiet. They did have a quarterly budget forecast last Thursday. this forecast, they do one every quarter. This is the one that really is only information only. It doesn't, they don't start making budgets or budget proposals based on this forecast. It is just an update to the Joint Budget Committee. But for the fiscal year that ends next week, the state is expecting about $116 million more than it had anticipated. That will just essentially go to straight to the budget reserve to get it closer to that 15% target. So unfortunately, no extra money is going to start flowing through it. That really just kind of goes to help shore up the reserve that they dipped into last year. For next year, the shortfall is only, I say only, but only about $300 million. Considering when the last couple of years, it's usually been a billion plus. 315 million shortfall is definitely a better sign in terms of going into next year. Things can obviously still change, but at least that starting line is a good starting point. Keeping in mind that shortfall is keeping in place several cuts, most notably the Medicaid reimbursement rates. That's assuming that those don't go up at all, or go down further. So just kind of keep that in mind. They are expecting 2 years out as additional federal cuts take effect, that the forecast is expected to deteriorate 2 years out. Just awareness, but a lot of things can change, but that's just what they say. The state is expecting, it's weird, but I'm happy to explain further, but the state is expecting TABOR refunds to return for next year. That's good news for their senior homestead tax exemption. Because that's the first thing that comes out of TABOR refunds is the homestead tax exemption. Right now, they're expecting next year's refunds statewide to be about 330 million, and then about 512 million the year after that. The senior homestead tax exemption takes about $200 to $250 million a year off of that. And so even when you take that out, there's still funds left over for other refunds for the citizens of Colorado. So that's kind of the budget forecast. Again, it's information only. The next one in September is when they'll start actually using that to prepare actual budgets. But at least the initial signs are better than they have looked at this time in the last couple of years. So there's that to look for. And then just quickly on ballot initiatives, you're probably seeing a lot on different signatures collected, different title reviews, just all sorts of stuff. We're expecting it to be a heavy ballot initiative year, so just be ready for a huge ballot to be mailed to your mailboxes come October, I think. Keep in mind, so early September is the deadline for those ballot initiatives to be ready. Even if a ballot initiative gets all the signatures, even if it goes through all the processes and is approved, the organizers for that ballot initiative can always still pull it before the deadline of early September. So it's a little early, but I just want to make everyone aware that there's a lot of moving pieces when it comes to ballot initiatives. You're going to see a lot in the news. Nothing is really going to be finalized until early September.
Any heads up as to what some of the things we can expect to see that might affect us directly?
So on the AAA side, none that I'm following. I mean, there's going to be some budget things. I know there's a push for a graduate income tax, which is just going to change a lot of things. And that's when I will then phone a friend, Ed Bowditch, who is a fiscal nerd much more than I am. And I say that lovingly. I think he would take that lovingly. But he would be the one that we would ask, say, hey, what does this mean? Because it's just going to impact the budget overall. Like I said, not specific to aging services or senior services, but just in terms of what the state can fund or not fund. One that we are tracking in the building, but not so much on the AAA side, is Initiative 175, which is the Restore Our Roads initiative.
Which is what?
The Restore Our Roads. There was a House bill that went. That one's just there's a lot to it. You've probably seen several editorials, probably several letters to the editor. Both sides are being very active in the public side on this. So, but those are kind of so far the ones.
Thank you. Debbie, do you have a question?
Yeah, I do. Considering what's happening in terms of the federal government regarding mailing of ballots, do we suspect that there will be any concerns about the November ballots coming out? Does it only affect federal and not state stuff, or, what's happening with that?
That's honestly, I really can't answer that one or the other.
Okay.
That would really be a question more for like the county clerks
Okay,
or Secretary of State. I don't get into ballot or election administration, and I have no plans to get into that area anytime soon.
okay. Well,
Yeah.
if you find out, you can let
Yeah.
us know.
Melissa,
So on the Commission on Aging, we do have our county clerk and recorder, Steve Schlager, is on the Pikes Peak Commission on Aging. And so potentially we could ask him to come and kind of give an update on what that's looking like.
Mhm.
Also, he gives almost weekly updates to the El Paso County Commissioners. And I may ask him if he's going to be commenting on something like that in the near future. And you can tune in to a El Paso County Commissioner meeting and hear him give his updates
Great.
too. So I'll ask him and have him, we'll kind of work through, talk with our executive committee if we want to have him come here or how we might want to learn more from him on
Great,
that.
I appreciate it.
So
that's an excellent idea, Melissa. Thank you. Are there any questions online? Seeing none, Mr. Gordon.
Melissa, Steve also sends out a weekly newsletter in an email. If you want, you can either contact him directly and ask him to include you on his mailing list, or I can reach out if you want, ask him to add you to his list.
since I'll reach out to him, I'll just ask him all that. So that'll save you the trouble, and thank you. I didn't know that either.
Yeah, he supplies a ton of data, a ton regularly, particularly during this voting season. We get it almost daily. It's wonderful information. I just love it. Of course, I'm a data nerd, so. Okay, any other questions for Mr. Jared? Thank you, sir. Welcome back.
Thank you. I'm glad to be back.
Okay, the next thing is the chair report. I have nothing except July 4th. Just everybody locally has their own celebrations. We just got this morning, literally, I got slid under my mat on the outside of the house, permission, a letter of permission to be a resident and be on the streets. Well, they staged the parade right in front of my house, literally. So you have to have your little card in the window, or they stop you. You can't go anywhere. So July 4th coming up. Big stuff. Lots of people coming to Monument and the surrounding area. Other than that, I have nothing, because everybody's reported on everything that I had. Melissa.
Thank you for for this. Looking forward to July 4th celebrations coming up. And then I also realized that we have two other commissioners who have joined us since we started, and that prompted me to think about something else as well. So I wanted to acknowledge online, we have Susie Walton from Park County, and then in the room we have Lakita from Department of Human Services. So welcome, ladies. And then that made me think part of the Area Agency on Aging Director report, Andy went up and met with Park County Senior Coalition, the Senior Alliance of Platte Canyon, and met with Representative Brittany Pedersen, who serves their community up there at the federal level. And I didn't know if Susie might want to comment a little bit about how that meeting went. And so if Susie can actually hear us, because I know sometimes people are in their cars doing things, but anyway, if you wanted to update our group on how that went.
Yes, sorry, I couldn't be there in person today. I think the meeting with Brittany Pedersen and her staff person, whose name is escaping me at the moment, went really, really well. I was there, Penny Evers from Senior Coalition was there, a couple of representatives from Seniors Alliance of Platte Canyon were there, and forgetting who else was there. anyway, we had a really robust conversation about the complicated issues facing seniors. And one that, you know, I haven't heard a lot of airtime given to here today. I mean, kind of all the same stuff, right, that we talk about in this forum, we relayed to her. But the one real different thing that came up was fire mitigation is an incredible concern for our seniors, and the related cost of getting insurance as well. So we heard that some things that are really, really pinching our seniors, not only is the high cost of housing, but then you add on that they have to mitigate around their house in order to get a decent insurance rate. But then if their neighbor can't afford to mitigate and their trees are too close to your house, your insurance is high. You know, couple that with the fact that we don't really have a grocery store, just a few small markets in Park County, got to drive to get medications from the pharmacy, drive to get groceries, drive to medical. Like all of those costs are really, really killing our seniors. And so I think that was new information for her to some degree. And the insurance fund that's been created will hopefully, the statewide insurance for, what is it, for catastrophic, I'm forgetting which bill, Jared, you probably know, created that, maybe will provide some relief. But in the meantime, word's not out about that stuff. And we have some unique challenges up here in Park County. But Brittany Pedersen, Representative Pedersen could not have been more attentive and interested, and followed up right away. So we were delighted to be heard.
Sounds like good fodder for the 4-year plan too.
You know, I really think it is. And I regret that I missed that meeting yesterday. Sorry, I had a death in my family. But I really do think we need to consider that. It's huge. And I don't know if any of you have driven through Park County lately, but we've had quite the rash of beetle kills. So we have tons of kindling up here. It's actually quite frightening in a year as dry as this one. And so I think we should consider that. I'm certain that our Teller County partners, Kathy Lowry, might agree that this is something, you know, impacting a large swath of our region, at least geographically large, right?
Absolutely. Susie, thank you. Yes, Melissa.
And Susie, am I right? And did I hear that Pedersen's office reached out to you guys because she wanted to hear from the senior population in Park County? Or do you know how that meeting ended up coming together?
I do not. Penny, do you know how that came together? I just got invited, so I don't know. But it was really wonderful to have Andy join us. It was a great, that's who I forgot to mention, Andy. It really was a great conversation. I think we looked really united, and I think but I don't know how it came about. I'm sorry.
Phyllis?
It might take,
You need to be unmuted.
yeah, it might take Tom a second to unmute her.
Okay.
And then she'll have to unmute on her end too.
All right, there we go. Good morning.
Thank you.
They actually reached out to us directly to set up the meeting. So it was very private, kind of, enclosed kind of meeting that they just wanted to know what was going on with the seniors in Park County. So it was really great that they had reached out, and Dennis was her assistant that was there too. And he had set the whole thing up. So really great opportunity to be able to talk to them direct. And Andy also was in the meeting too from Pikes Peak. So that was like a double plus for us. So that's it.
That's good news. Any other comments? Okay, hearing none, we'll move on to discussion item. Older American Act rule updates.
All right, so that'll be me again.
This is going to be the Melissa show.
No, fortunately, some other people have definitely been speaking up. And I am sharing this with Mariah. So I'm super excited to have Mariah join us and be kind of on the spot, kind of sharing some information in her role as the contract administrator. So again, just to kind of remind people of what this is, our state unit on aging is working to implement the federal rule changes to the kind of Older Americans Act, Older Coloradoans Act, here in our state. And so they've been having these really robust online meetings to show stakeholders where the changes are happening. And so we have two to share today. One of them is that I'm going to start with is kind of the caregiving and just some basic definition change things. And I will be forwarding these slides out to people for you to spend as much time or as little time as you want looking at them. There's a lot of really kind of good information in there when you have a chance to look. So if you can, great. But if not, just know that the State Unit on Aging is really taking a concerted effort to implement the changes and the language, and a lot for us to kind of learn from. And for our partner organizations who actually have sat in on some of these, I think that's really beneficial and good. So again, I'm just kind of starting here with this was the talk that they did on kind of just definitions, this concept of greatest economic and social need. So you can see that right at the top. Basically, that language has been added into everything. And even though as an area agency on aging, we know that we do want to be focused on making sure that we are the payer of last resort with our Older American Act and Older Coloradoan Act money. There are times where we're not always really tracking closely that the individuals we're serving are the folks at greatest economic and social need. We had some conversation just here with staff the other day where some issues were brought up of, well, what does that really look like? Because even though we can actually do a checkbox that someone is in a certain income category, there was still some question about what that really looks like and what that really means. So this will be interesting going forward. I have not been able to actually sit in on any of these conversations, so I haven't heard the different conversations, but I know Mariah has, I know Debbie did. So, we'll kind of have some other comment here in a second. So that said, go ahead. And Tom, if you wouldn't mind going, I think, to page 23 in the rack packet itself. So I guess we're here. Let me see if we're here officially. So this was new language that was added to the family caregiver kind of area, which to me was really interesting. There's been a lot of language that's been added to the document, and I just thought it was interesting to see. And so here, they're talking about, just scroll up a hair for a second, Tom, if you wouldn't mind. I just want to see what's, so family caregiver support services include. So that's kind of the category we're in here right now. And so we want to make sure that family caregivers are getting assistance, case management, care coordination. We know that's already happening. Go ahead and scroll down a little more. The individual counseling, helping them with nutrition, complex medical care, financial literacy, again, all kinds of things that we're doing, but now it's actually kind of in here and really being called out and acknowledged that folks are doing it. Again, recognizing number 5, that we want family caregivers and their care recipients to be able to access transportation, material aid, all those kinds of things. So, are they getting access to home modifications when they want it, that material aid? Are they getting dental care if they need it? All that kind of stuff. So there was another part in here where again, it did, go ahead and scroll down a little bit. Okay, stop. Oop, perfect. Go up number 1. Thank you, Tom. And this is where I made reference a few minutes ago, where they have added the language in. You can see where they've crossed things out from before, but then added things in red. So priority for caregiving services are given to caregivers who are older adults with greatest economic need and or social need. And so they're just making sure that this is getting acknowledged, called out, and kind of highlighted a little differently. Scroll down again. And then you'll see a lot of things that have been taken out. And as I look at this, I'm like, oh my gosh, what did they take out? But so a lot to look at, a lot to read. But then when you go back and kind of take a peek at just red, items that have put in, things look pretty good. So I think it's an okay balance, and we're going in the right direction. And I'm going to be super curious when I share this with Lucy, when we have time, to get her input on the things that have been added and changed there. Okay, I'll pause for a second for comments and questions.
I have a question. Some of this looks and sounds very subjective. Is there any attempt to make it objective?
For those who have sat in on the calls, both Mariah and Debbie, I'll let them kind of answer that maybe in a few seconds. But my thoughts is, I feel like they're taking language from the Older Americans Act and literally just making sure it's getting plugged in here. And I don't know how much, sway we have if we think we want to see something different, to be able to change it, because some of it really is law and it has to be there, right? But I think, they're definitely making notes of, if people are, sharing anything during open comment. There was a lot of things that went on with the nutrition, and with Mariah being brand new to this whole world, she's just like soaking it all in, taking as much as she can. But even she kind of saw a few things that were like, oh, this is interesting. But for the people who are living and breathing the nutrition programs, I am curious if they've had a chance to sit in on any of these and if they are feeling really strongly one way or the other. And I'm not going to allow those folks to make comments today about that. But if they have comments, Kathy Lowry, Lori Wood, Penny Everest, I would encourage you to reach out to Mariah and talk to her too, for sure. And then maybe Mariah can share some of those comments back with the RAC, if she's heard anything specific. But for time's sake, I'm not going to open that up to everybody. But so that's my feeling, is that maybe objective, subjective. But with that, I don't know if Debbie, since you've sat in on those, if you have.
I only sat in on nutrition.
Yeah.
But I can comment on that one.
Well, when we get to it. Okay.
Mariah?
Thank you. Yeah, so as Melissa said, these updates are geared towards achieving federal compliance regarding nutrition services. And to answer your question, they are taking comments, and I was going to list here, there is PDF file and PowerPoints that are either here at the table or they'll be emailed to everyone. And if you have any comments or questions or concerns, there is a point person that you can contact, Lori Strother, and her email is in the PowerPoint as well. So she's someone that you can converse with, give her concerns to, and have just a basic discussion on what you're feeling with these changes. So can I continue?
Please.
All right, so I just wanted to briefly go over 5 points that I kind of highlighted. I do have a background in nutrition, so these kind of spoke to me, and I wanted to explain a little bit more and highlight them. And as I bring them up, Tom will pull them up on the screen to show what I'm talking about. Okay, so number 1, regarding grab-and-go meals. And that, Tom, is on page 29.
Okay, excuse me one moment. Gordon, did you have a question about something prior to?
Yeah. Before the strike through where you went through A, B, and C. Tom, can you go back to that? Yeah. Yeah. Okay, good. You're getting close. Come down, come down. Keep coming. Right here. Number 3. Caregivers who provide care for children or adults with severe disabilities. My comment on that would be, what's the definition of a severe disability? What's severe to you may be different to as severe to someone else. So that's, when Laura talked about subjective versus objective, severe disabilities to me and used in this sentence could be subjective from the standpoint it doesn't give a reference, it doesn't give a definition. So that would be the only point that I would make.
I will take a peek closer. Sometimes at the beginning of each document, they have about 15 different definitions of things. I'll see if that was mentioned, so I'll go back and look at that. But then if not, I will also kind of follow that up with a formal response to Laura, because that's a very good point, I think.
Thank you, Debbie.
And if you can just slide up there at the very beginning of these, the 1, 2, and 3. So I didn't go to this meeting, but I see that we've always had this statement about greatest economic need. I mean, that's always been in the Older American Act, but I see, and I don't mind that they say preference given to low income, but they're striking out minority older adults and older adults. What?
Sorry to interrupt you. They actually do have that in other places where they are still
I would have been
calling that out. Yep, no, they are, they do still have it in other places where they're mentioning that.
So because of this, I think agencies have had to set up waiting lists if they have people who don't meet that greatest economic need, because the money that they get may not be able to fund all the different things that they want to do. So that's always been in the old one.
Okay, Mariah, sorry to interrupt. Oh, yes, Jared.
If you don't mind, before we get to the nutrition specific, finally got that out. I just kind of wanted to level set on terms of what we say comment and that kind of stuff, just because it's going to be easy to confuse the two. So right now we're in the stakeholder process or the state rulemaking process, and so the rules are not out for public comment yet. There will be a formal public comment period after the draft rules are finalized. Right now, they're just in a stakeholder process, which is open to anybody. They're treating it very similar to a public comment hearing. But there will be a formal public comment hearing, public comment process at the end of the stage. So I just got to make sure we're careful in our terms and understanding this will not be the last time to comment. Kind of to the point of objective versus subjective. From a staff side, maximum flexibility is always good. And that's kind of where you get to subjective part. I think if there's specifics that we want to see, for example, severe disabilities, that might be referencing a term in a different part of the federal regulation. But we can definitely look at that and get back to you, as Melissa said, we can look and see if there is a specific definition or if it's just that's the term. So I'd say we can definitely look into that if you guys have specific questions on specific terms and report back to RAC members on that. But yeah, if you're seeing some specifics that you would like to be seen, I think now is a better time to get those in as opposed to the formal public comment period and the hearing. Because once you get to that stage, while changes can be made, it is a lot harder. They're a lot easier to do now.
Perfect.
So before we got into the nitty gritty on nutrition, I wanted to kind of do that high level overview.
Well, thanks for level setting.
Yeah.
Yeah.
Thank you.
Yeah, thank you, Jared.
I'm
That's
sorry for the interruptions.
no worries. Okay, so I'm gonna highlight 5. And Tom, the first one's on 29. Regarding grab and go meals specifically.
And I think it is possibly in this part, but
Okay, so
in the red definition there, but
I'll read it then.
At the end.
Regarding the grab and go meals, congregate meals can be eaten virtually or with others. Previously, virtual was not allowed. I'm assuming that during COVID, that was a thing, but then after they removed it, now they're putting that back in. So I thought that was a really good point. Number 2, Tom, is 50 and 51. And this is regarding home delivered meals. What they did is they removed homebound requirement to receive delivered meals. Previously, you had to be homebound in order to receive home delivered meals. So again, that's a plus. Yes. Okay, number 3, and that, Tom, is on 41. And this is regarding income earned awards. Awards should be used to expand nutrition services such as home delivered meals, nutrition counseling, nutrition education, or any other nutrition services. It does not include supportive services such as outreach or transportation to a meal site. Number 4, Tom, it's 46. And this is regarding nutrition counseling. Nutrition counseling can only be performed by a registered dietitian, not a technician as they previously had used. This may be an issue because, as you know, a technician the pay is lesser for a technician versus a dietitian. They charge more. And so this may be an issue with budgeting. I'm not sure, but I just wanted to point that out. And the last one is on 47. And this one is regarding the HIPAA rules. All nutrition programs, and that includes meals, nutrition counseling, nutrition education, they're all subject to rules and regulations of HIPAA. And when you think about it, you kind of say, well, how is a meal a HIPAA violation? But some diets are referencing specific diseases, and so they've thought that they should add that into the regulations for HIPAA, which when you think about it, it kind of makes sense, right? And that was it. That was the 5 that I kind of picked up. However, you guys could read this when you get the documentation, and there might be something that kind of sticks out for you. And as I mentioned, Laura Strother is a person that you can contact to have those discussions.
Debbie?
And I will mention one more. I kept a little thing of, I had all the same, I had all the same things written down. So basically, just to say, they really left all of the rules that they added during COVID, like grab and go. No, you don't have to be homebound to get a home delivered meal. All of that stuff they made allowances for during COVID, and we thought they were going to disappear, but they kept most of them. So I think that's good. I don't know, Melissa, if this was an issue too. So that if you have money left over from your meals, you can't use those in other sections of meals. You have to use them only for meals. I don't know if that's the case currently, but that's something that was added for this year. So I don't know if you picked that up as well.
Yes, we did. Actually, Melissa and I talked about it yesterday. And it seemed that probably in the past, they've used money for like the transportation piece.
And they're not going to be allowed to do that.
Right.
So they have to expand more meals rather than providing other kinds of services. So the one question that I brought up, because I did attend, I don't know if you remember, I was concerned that, and I recognize that it's really good that we can provide home, we can provide people not necessarily at home, have to be homebound, but that in the past, the nutrition program has always had two major things that it wanted to do. It was provide meals, but provide socialization, especially by attending a congregate meal site. And I pointed out that all of these things that they're adding, which while good and added during COVID, are going to allow people not necessarily to attend meal sites, which means less social kinds of things going on. And I just brought that up, and I just thought maybe we have to think more broadly in terms of how can we socialize with those people who are taking their meals at home more. That was my comment. I don't know if you remember.
Yeah.
I was the person who made that comment.
Okay, and I thought I remembered someone saying that those meals that are at home, that there is an option of a group that meets on the computer, and
she did point that out, but
Yeah.
I don't know how widely that's used. I don't know if our region, whether that's used consistently, but I thought it might be something that our nutrition providers might want to look at even more. I mean, and then we get into, do people have computers? Do they know how to, do they know how to do all of that? So, those are all the issues that come up when we talk about that.
And when we talk about socialization, enter transportation. So you've got that element as well. Everything's interconnected. Melissa.
But in general, I think it was good that they kept all the things that were allowed during COVID, which allowed a lot of people to get a meal at home who were not able to get those kinds of meals.
Melissa.
So a couple things are running through my head. I think first I want to circle back to the grab and go meal, that people who, before it was, you really couldn't, kind of take a grab and go meal from a congregate meal site and then leave. And now you can continue to do that. I don't know that I'm super clear that automatically translates to if somebody wants to stay home, that our contracted providers are going to now be responsible for driving that meal and doing a home delivered meal to folks. I think that people who, have decided that they kind of feel like they want to have a meal at home are still going to have to somehow drive and get to a congregate meal site, pick the meal up and then go. But I'm still looking into that a little bit more. And then as I say that, I'm now thinking that I might lean into our providers who do these services and potentially have them present at our next RAC meeting and talk about kind of some of the things that they are looking at. That'll also give them time if they haven't dug into this to allow them to do that. And so I might have them come and we'll talk about this at executive committee in terms of a presentation for July. And then from the socialization perspective, it's interesting that, the state wants us to provide services to folks based on, a socialization need as well. And I think this just allows us a lot more opportunity to say, okay, so what do people really want to do for socialization? And maybe they don't want to do a meal, but they want to do other things. And, from a RAC perspective and a funding perspective, do we need to, look at, 2 years from now, funding more, evidence-based programs and things through the Y and the senior center for more socialization. What does that look like? We're doing a 4-year plan. Some of that might factor into the 4-year plan comments. So I just wanted to mention those things. And again, thank you, Mariah, being new to your role, really digging into this and taking a look. And the fact that you bring some background and experience is wonderful. And we'll look forward to maybe having our providers maybe share some comments in the near future.
And I just want to say, Melissa, that I think it was pretty clear that a grab and go meal, even if they were going home, was still considered a congregation. That grab and go wasn't placed under.
Home delivered.
So it wasn't that an agency that provides meals is now going to have to get that grab and go to somebody who lives at home. I thought that was pretty clear.
Okay, good to hear. Good, thanks.
Well, thank you. This is a good basis for the 4-year plan. And we have an opportunity to send comments, and I mean, this is an open door for us. And yeah, I attended 2 previous of these and different subjects, and Laura's got her hands full. She's spearheading the whole thing, and oh my gosh, but it's good that there's one person, at least I think, to
And she probably has some help
Oh, I'm
answering questions, but you're right. Yeah, she does a lot.
any other comments regarding the rule updates at this moment? Remember, do them, get them, forward them, etc. Okay, any other comments? Yes, Melissa.
Since we don't have a spot for announcements on our agenda here.
Any other announcements?
I would like to just take a minute, and for those people who are close to El Paso County, Colorado Springs, we do have coming this Saturday at our senior center. I'm just doing one more call out again for the Engage program that's happening at the senior center this Saturday. There is a cost to it. It's being put on by the Senior Resource Council. They have 4 workshops that are happening, speaking of kind of social engagement and thinking about nutritious food. There are things, they're doing Mediterranean diet. They're actually providing a Mediterranean diet lunch. And it's the keynote speakers who are launching it are Councilwoman Nancy Hingham from the Colorado Springs City Council here, and then the woman who runs our Hey Neighbor kind of grassroots neighborhood connection group. They are kind of keynote speaking at this event, and there is a $25 cost. But there could be some scholarships still available for people who don't feel that they can pay. And so just wanted to put that out there. We will have a booth at the event. And if people are looking for something to do on Saturday and have not been to the senior center yet, please come. But you do need to kind of RSVP so that you can let them know that you're coming. So just wanted to put that reminder out.
Thank you. Yes, Debbie.
Melissa, can you maybe just give us some idea what happened in senior games?
Yeah. Have we not met since the senior games? I guess we haven't.
We have not.
And I just had a meeting with Sports Corp this morning too, to touch base on that. So thank you for those who came and volunteered. Sheila Williams came down from Park County and helped man the table. Debbie came and manned the table. Did B come and man the table? So it was great. We were at the Olympic Museum on Friday. Really great showing of people, folks coming. It was wonderful. And one of the really good things that we did this year with the help of some of the volunteers who were on our kind of ad hoc committee was to kind of enhance dementia awareness. And so we brought in the kind of hidden disability sunflower badges that it's an international awareness campaign. Oftentimes you'll see them kind of in airports is where kind of it's commonly happening, but again, international. And basically what happens is, if you have a hidden disability, so if you have autism, if you live with bipolar disorder, things that, oftentimes in the past a person has kind of, found themselves in a lot of trouble with, security individuals because they don't understand that people might respond a little differently. And so you can wear this lanyard around your neck, and they're trying to make it be internationally recognized that a person might have dementia, Alzheimer's, a hidden disability. And so we put that out at the senior games, and people loved it. It was such a great conversation item. And so I'm hoping to get this shared with our leadership here at our agency, because there is a fee to be a part of that program. So technically we can't just freely throw these things out into the community. We really need to be a member. And as a nonprofit, I think it's a $250 fee to be a member. And then they give you access to the resources that they have, and you still have to pay for the lanyards. But they gave us a whole bunch of them. And so like I envision at some point in time, this could be a really great program that when we have these expos and we have family members who come, I have been there at the Gazette Expo where it is shoulder to shoulder people. You have caregivers, and they have a person with pretty advanced dementia who's kind of doing some things and nobody knows. Luckily we're kind of among friends at these senior expos, but even still, I can see people, kind of expressing some concern over, a person who clearly has advanced dementia and is struggling a little bit. And if they had their little lanyard on, it would just be a kind of a whole different, kind of engagement opportunity for people. So hoping we might do that. And so that was launched for all intents and purposes with the senior games. People loved it. And the senior games themselves were incredibly successful this year. They had a 45% increase in athletes who attended. Amazing. They had good television coverage. I did not get a chance to see any of the TV coverage, but they did have KKTV and Fox TV that did do interviews, and they did air, but there was still not an article in the Gazette. But that's okay. Beacon Senior News covered it, so that was great. And just it was wonderful. There was discussion about how hot it was at some of the outdoor events, and that can be a little bit of a struggle. And some of the volunteers are older adults who are volunteering, and you're talking heat stroke. It was really hot out there and hard to find shade sometimes. So that was kind of brought up at our meeting this morning. A shout out to our coworker Dolly, who's been really involved in this and really engaged. She's got lots of great insight about things, and was really helpful as well. And then our Commission on Aging folks are the ones who really stepped up and really volunteered and did a lot with the senior games. So
Misting station.
What was that?
Misting
A
station.
misting station that was not brought up. Thank you. That's a great idea. So, yeah.
I'll just make one other comment to somebody who volunteered. So a lot of the people were from out of town, especially the people who were softball people. They came from all over the US to participate. And so, they'd have questions. They didn't really know what an area agency was. And so, I kind of explained, I said, we do this yellow book, but they're all over the country. And they wanted to know, they were like, really? So I kind of explained to them how they find that information, because a lot of them said, wow, there might be services for my mother, because, there are people who are 50 and above for the senior games. So there were a lot of people who asked me questions about, where do I find this information on the area agency where I live? So having worked at an area agency, I was able to tell them how to do that.
Again, one word that always comes up: education. Getting the word out there and making it available. Well, I'm kind of looking forward to next year, because I'll speak for myself, but I didn't have enough advance notice of what was going on. I think we need to make sure we do that, and then we can get the word out too, because when I told people about it, they were like, well, if I'd have known, okay, we'll just, put that on the radar. Let's make sure we give some notice.
So I didn't want our group to meet again until February. They all screamed at me and said, no, we're going to meet in September. Fine. fine. I think that's fine. So yeah, so hopefully, we can keep the momentum going, and we even have a person from Denver who participates in these meetings. And so, hopefully, yeah.
Great. Thank you. Thank you. Any more announcements, Melissa?
That's it.
That's it. Any other comments? Anything online? Any hands? Oh, there's Sheila. Sheila, please.
I just wanted to say, I thought it was a really good event. I'm really glad I had a few minutes to spend, and my husband enjoyed seeing the museum there, the Olympic Museum. But we did meet a lady who was a caregiver, and told her this was just before the caregiving event. So I don't know if she was able to get there, but she was very interested. So I think it was a good participation event so that we could educate people. Just wanted to say I'm glad that I got to spend a little time there.
Yay. Okay. If there are no other comments and there's nothing else for us to discuss, I will adjourn this meeting at 11:11. Thank you all. See you next time.